first of all, we require sponge holder and normal saline for cleaning the external and internal part of the vagina. We use a Cusco speculum and we practice non-touch technique, which we'll be showing you shortly. Another way of a non-touch technique is using double sieve speculum. For difficult IUI in which the cervix is difficult to visualize or flush to vagina, we use a Ellis forceps, hold the posterior or the anterior lip of the cervix and then insert the catheter. In cases of cervical stenosis, we use a metal catheter to direct the cannula properly. This is a IUI catheter. So there are many companies which have their own IUI catheter which has a bend or is straight. The angled cannula can be helpful in cases of acutely anteverted uterus. So here's we beginning with the cleaning of the external part of the vagina as well as the internal part of the vagina with normal saline. The patient may experience some discomfort during the cleaning of the vagina as well as insertion of the speculum, but a good reassurance and proper counseling can help us mitigate this step. After insertion of the speculum, look for any mucus. If present, we can clean it with a sponge on stick with normal saline, or if there is some mucus present on the external os, it can be cleaned with a Q-tip dipped in normal saline. If the cervix is not being visualized clearly, you can ask for head-low position until the external os is clearly visible at your eye level. This is an IUI cannula with a 1 ml PD syringe. This is the guard of the cannula which has to be adjusted before inserting into the cervical canal. So you have to adjust the guard according to the uterocervical length that has been measured previously on TVS. Some practitioners prefer to flush the catheter with the media before taking the sperm sample, that is the washed sperm sample. So once we open the cannula, we hold it by the shoulder, take a look at the guard and adjust the guard according to the UCL. Before loading the cannula, check the syringe for any vacuum and then attach the cannula to the syringe. Now, this assembly is to be used to load the cannula and the syringe with the semen sample. The assistant gets the vial of semen sample near you. Taking all aseptic precautions, insert the cannula inside the tube and then aspirate around 0.4 ml of the sample into the syringe. Once you have done that, you are ready to introduce the catheter inside the cervical canal. If you have any problems negotiating the os, you can always use a Ellis forceps to hold the lip of the cervix. Once the catheter is inside, wait for about 5 to 10 seconds before pushing the plunger. The movement of the plunger has to be uniform and slow so that there is no regurgitation of the semen sample. Wait for about 5 to seconds more and have a twisting rotational movement and slowly withdraw the catheter. This step would avoid the spillage of semen sample while pulling out the cannula. Always check the tip of the cannula after withdrawing it for any bleeding or injury to the endometrium while insertion. Now moving on to another atraumatic non-touch technique wherein we use two sim speculum, one to retract the posterior vaginal wall and one to retract the anterior vagina. Visualize the cervix properly. Ask an assistant to hold both the speculums so that you are free to navigate your cannula properly and easily.
So let us move on to some small tricks and tips regarding difficult IUI. So now what comprises a difficult IUI? Number 1, a deep vagina. Number 2, non-visualization of the external os. Number 3, non-negotiation of the cervical canal. So let us deal with the first problem, that is a deep vaginal canal or non-visualization of the external walls. So first of all, we have ranges of speculum that can be used for IUI. The most common that we use is a Sims double-bladed speculum, Cusco's double-bladed speculum, and this can be generally used in cases where the vagina is around 7 to 8 centimeters. A larger or a deeper vagina requires a longer Cusco speculum. In case the cervix is directed anteriorly, that means the uterus is acutely retroverted and retroflexed, we can use two Sims speculum. The one which goes into the posterior vaginal wall should be a larger one with a long and a broad base. So broad is more important because it will give you a good visualization of the posterior cervical lip in case you have to hold the lip of the cervix. The anterior vaginal retractor, in this case the Sims speculum, this one has to be a size smaller than the one that we are inserting in the posterior vaginal wall, and the broad base should be inserted inside. So another type of speculum that we can use in difficult IUIs is this, a variety of Cusco speculum. The differential point between the regular Cusco speculum and this one is that it has a broader blade, both the anterior and posterior blades are broader, and it gives a better exposure. Secondly, it has an adjustable height lever, so you can adjust the height of the Cuscos very easily, and hence your exposure would be much better. So once we insert the Cuscos into the vagina, just push this handle a bit upwards, lock it, and then retract, so you get a better exposure and you can visualize the cervix in a much better way, and hence the IUI becomes much easier.